Squalene and cancer. The factor that stimulated the discovery of squalene and its application was the evidence that occurrence of cancer is minimum compared to other people around the world in Scandinavian countries. Especially uterine cancer is very minimum among the women who live in the Scandinavian countries compared to other parts of the world. And scientists were looking for what exactly is the reason for this phenomena. Then they found that it may be due to the dietary components. And finally they found that it is due to consumption of olive oil. Then the second investigation was what exactly is the reason for olive oil giving this protection. And it is seen that it is conjectured that some of the components present in olive oil may be responsible for the low incidence of cancer among the Scandinavian population compared to people in other parts of the world. It led to the discovery of squalene and found that it is squalene in the olive oil that imparts this protective effect on the people of that area from cancer. Then further investigation showed how cancer can be prevented or cancer can be controlled or the complications of the cancer patient can be minimized by consumption of squalene. Later on, there is now accumulated scientific evidence that one of the major activity in cancer people is the production of so many blood vessels in that area, supply of extra nutrients to the area suffer from cancer, and then synthesis of cells, which finally promotes growth, overgrowth, and even tumor. And that process of formation of the blood vessels is called angiogenesis. Angiogenesis means birth of no blood vessels. It is now shown that squalene can considerably arrest the growth of these vessels. Secondly, once those cells are removed by chemotherapy or by radiation from the cancer region, there are several reactions that take place in that area due to high power energy radiation. One of them important is the fat present is oxidized. It releases a lot of compounds called free radicals and carbonyls, which are very harmful for man. And these carbonyls and free radical can attack not only the region, many other part of the region, and can further assist setting up of the cancer in other parts of the human body also. So one of the important method to be adopted is to prevent the proliferation of cancer to other parts of the region. And so far, squalene is the only molecule, safest molecule without any side effects that can be given to cancer patients to get at least some relief. Then, once a cancer patient is subject to radiation treatments, it gives a lot of complications, and many of the complications can be safely controlled and brought to the minimum by squalene. It has been proved clinically that application of squalene or administration of squalene orally gives a lot of relief to cancer patients, and the onset after removal of the tissues can be prevented by application of cancer. This is the major use of squalene in cancer treatment.